Do we have too much government?
We need to put people ahead of corporate profits.
This system is so lopsided.
This threat is a real threat to democracy.
And I think that's really important. That's something we haven't been doing in this country for a long time.
Where do you start? What do you do? How do you do it?
Access to Democracy and other Eagan community television programming is supported by Thomson Reuters, makers of Westlaw Next and based in Eagan. Through Westlaw Next and other innovative online services, Thomson Reuters is the world's leading source of intelligent information for businesses and professionals. Online at thomsonreuters.com. And by U.S. Federal Credit Union, the member-owned financial institution offering service, value, and experience you can trust to the greater Twin Cities community.
Welcome. Even without a signal from the control room, we're ready to go. And welcome to Access to Democracy. I'm Alan Miller, and a return guest, Dave Feinwachs, who has been called a lot of things, including whistleblower, healthcare expert. He's an attorney. You've got more degrees probably than a thermometer. I mean, tell us a little bit about how many degrees you have in different areas.
Well, I've always enjoyed going to school and learning. I hold 4 graduate degrees. I have 2 master's degrees, one in hospital healthcare administration, one in medical sociology. I'm an attorney. I have a JD degree, and I also have a PhD from the University of Minnesota in health services administration.
And on the 7th day he rested. But the fact of the matter is that 3 years ago, Dave lost his job with the state because he stepped forward and pointed out that we were being robbed in the healthcare department, and that the companies that were robbing us had been getting away with it. He spoke up, and next thing you know, he was a private citizen. Is that a fair statement?
That's a fair statement, although I wasn't employed by the state. I worked for the Minnesota Hospital Association, which was the trade association that represented all of Minnesota's hospitals.
Okay. And now you don't?
Now I don't, absolutely not.
Yeah. Now, since you were here several months ago, a few things have happened in the healthcare industry. I won't call it a profession, I'll call it an industry. But also something you told me right before we went on about healthcare costs in Minnesota, and I wish you'd repeat that for our viewers.
Minnesota suffers from a fascinating healthcare paradox. We constantly tell people that we're the best in the nation, we're the most efficient, our healthcare costs are the lowest, our system are the best, our systems are the best. And to a certain extent, that's true, but not the way you would think. The money that our doctors and hospitals and other medical care providers get is the lowest in the country. The cost of our system in Minnesota is the highest. We are, in fact, the second highest state in the country, second only to New York, according to a report that was released in September of 2013 that said that Minnesota's healthcare costs are very, very expensive per enrollee. Oddly enough, the same report also said that certain things like how we take care of children on our public programs were well below the national average. We lag behind in immunizations and well child care. This seems odd for a state and a group of HMOs that pride themselves on this wonderful system that they have provided us. And of course, we currently struggle to insist that the federal government keep shoveling money our way to maintain this system. And at the end of the day, what it all boils down to is our HMOs, our insurance companies that manage this system, make enormous, unimaginable profit and receive enormous amounts of money, but the people who provide services get almost nothing.
Well, are these the same HMOs, if I'm not mistaken, who were found to have secreted and put aside much more money in their reserves where they were actually treating the state? Didn't some of them have to give money back to the state?
Those would be the ones. Minnesota is basically dominated by what I'm going to refer to as a cartel of 4 so-called not-for-profit HMOs. And when I say so-called, if you look, you will find that all of them have for-profit subsidiaries established, which will allow the further diversion of their assets into private hands. And very few people are aware of this. But these organizations, for a single year, did in fact give back $103 million because for a moment in time they got caught and somebody did something about it.
And that came from Blue Cross Blue Shield?
That came from Blue Cross Blue Shield, Medica, Health Partners, and UCare.
Which are the 4 providers?
Which are the, and when you say providers, that's another interesting thing. People say that there has been provider misappropriation in Minnesota, or that Minnesota providers are highly paid or paid too much. That statement is only true if you consider these insurance companies to be providers. If you remove them from the equation, Minnesota providers are paid well below cost, in fact, shamefully below cost.
And we're talking about doctors and hospitals.
We're talking about doctors and hospitals and real providers who lay hands on people and provide what we consider to be health care, what the ordinary person would consider as health care, not people shuffling papers and issuing bonds and debentures in some office building someplace.
This is why, to me, single payer, as most of the world has in one form or another, is the only thing that makes sense. And the system here is we have these middlemen, these intermediaries, who don't provide health care, but who handle the money, and the people who really deserve to get the money and or the people who deserve to get the treatment are on the short end.
Exactly. You'll get no argument from me. Single payer would be infinitely better than this system if for no other reason you would have some transparency and accountability. When Minnesota outsourced these programs to these corporate entities, we have no paid claims data. We have no idea how much money we've spent on these programs. We do know the programs are obscenely expensive. We do know that in 2013, in March of 2013, a report was released by the Siegel Company that says that these HMO vendors took for themselves 100% excess profit every year for 8 consecutive years. I cannot emphasize to you how much money and how bad that is in terms of the management of these programs, yet most people, particularly our legislators and our policymakers, appear to be oblivious to this, which is, in my estimation, criminal.
And the fact of the matter is, you're talking about $1 billion.
That's what we're talking about. We're talking about $1 billion. And how do we get that number? Well, if you look for the 1 year at the money they gave back, they decided to give back $103 million for 1 year when people were looking. Okay, 8 times that would be $800 million, close to $1 billion.
Now, isn't it a fact that healthcare organizations are allegedly nonprofit in this state?
Healthcare organizations are allegedly nonprofit. When
and
I
that's
say
a great misnomer.
It is a misnomer, because you understand that nonprofit status means only that you don't pay taxes. It also means that you and I, all of us, we pay more taxes, so they don't have to pay any. But it doesn't mean that there's something magical about them, or righteous about them, or anything that anybody would consider appropriate, by definition. It just means they don't pay taxes.
However, it doesn't stop their upper management from getting incredible salaries.
It doesn't stop multi-million-dollar salaries. It doesn't stop obscene bonuses. And the other thing it doesn't stop is it doesn't stop the beneficence of these organizations in terms of donating money to other organizations and interests, which buys friendship. Even though their actions are far from laudable, if you give other people enormous amounts of money, human nature being what it is, suddenly they're your friend.
You build a relationship.
You build a relationship, and then when people criticize them, you immediately rally to their defense, because you certainly don't want that flow of cash drying up. But the real issue is that flow of cash was supposed to be directed at providing our citizens with health care. It was supposed to be directed at adequately reimbursing doctors and hospitals and nurses and chiropractors and
Instead,
pharmacists.
it's going to a bureaucracy.
Instead, it's going to a private bureaucracy, which is worse than a public one because it's invisible. It's opaque.
And who, other than you, where you came forward and actually got cashiered from your job for telling the truth, who has control of oversight of these organizations?
Well, we now know in April of 2012, in Washington, the Congressional Committee on Government Oversight and Reform issued a report that said Minnesota was a stunning example of lack of oversight.
Was that Senator Grassley's committee?
It was Darrell Iss's committee, but Grassley testified at it, so he was involved in that. And the stunning lack of oversight is apparent on the part of our legislators. Recently, just 2 days ago, one of our legislators wrote a letter to Kathleen Sebelius, the head of Health and Human Services in Washington, D.C., saying Minnesota represents a model, a paragon of cost efficiency, low cost, and a wonderful system to provide health care. Well, apparently this legislator hadn't bothered to read the Siegel report, or hadn't seen the report that came out in September saying we're the second highest healthcare cost in the state. And by the way,
In the country.
I'm sorry, in the country.
Yeah, second only to New York.
Second only to New York. And by the way, this is not startling news because our legislative auditor for Minnesota in 2008 published a report that said our costs for these programs in Minnesota were higher than most states. They were accelerating more quickly than most states, and that our payments to providers appeared to be low, but somehow magically our HMOs always did well in the aggregate. And there was no explanation for this. Well, rather than continuing to dig deeper, as is so often the case, that report resulted in sort of a keep on truckin' finding. You know, whatever we're doing, we should keep on doing it because we've been doing it so long, you wouldn't want to change. Well, the first rule of getting out of a hole is to stop digging. And so if you can clearly see that the programs are too expensive, you have no data, people aren't getting services, you're under investigation, you would think that policymakers would say, wait a minute, we're going to take a look at this. But then you return to the issue of how much money goes out for campaign contributions, for special interests, for other things, and suddenly there's no interest in getting to the bottom of it.
And speaking of campaign contributions and other things, these HMOs hire lobbyists, do they not?
They have an army of lobbyists. After I parted company with the Hospital Association, the first year I began working at the legislature on this issue solely, I was confronted with 27 paid contract and employed lobbyists on the other side. And there's a huge amount of money that goes into these efforts.
Now that money is money that's coming from the HMOs. That money is money that they receive allegedly to provide medical health care, and instead it's going out to really feather their own nest.
Not only is that money that should have been used to provide health care, but more importantly, that money is money that came from taxpayers. When these HMOs receive money to manage our public program, it's 100% taxpayer money. They're taking taxpayer money and they're hiring lobbyists to advocate the perpetuation of a system which steals from the taxpayers, steals from the government, defrauds everyone, obfuscates and conceals where the money goes, and we're paying for it.
Now, aren't there some legislators who are aware of this and can do something about it?
Well, there are legislators who are aware of it. Doing something about it gets to be a little more dicey. If you've ever been to the Minnesota State Capitol, you will see what I'm talking about. I teach a course at the University of Minnesota, and I tell my students that lobbying and working at the state capitol is very much like being involved in a courtroom trial, except that the evidence has nothing to do with the verdict and that jury tampering is encouraged. And so it is, in fact, very, very difficult to change these kinds of things, but if enough pressure is brought to bear, if enough people watch programs like this, take an interest, and basically get angry, which, and I don't mean to suggest this in the wrong way, but right now we have a catalyst for this kind of anger, and it's called MNsure. MNsure has touched the lives of a great many Minnesotans. And when I say touch the lives, I mean touch their lives like a case of bubonic plague. Okay? MNsure,
That's sort of putting it bluntly.
MNsure is a disaster. But if you take 2 steps back, let's think about where MNsure came from. The Affordable Care Act created an exchange where people were going to buy the insurance that the law now mandated they must have. But in Minnesota, largely at the urging of our nonprofit HMOs, we said Minnesota must require its own unique exchange. We want to have an exchange in Minnesota that's unique to Minnesota. We don't want to use the federal exchange. Give us tens of millions of dollars and we will create an exchange, and we called it MNsure.
Actually, there are, 15 or 16 states that did the same thing that we did.
There are a handful of states that did the same thing.
Interesting, all with, as far as I know, except 2, all with Democratic governors.
Yes.
As opposed to the Republican-governed states. For instance, Texas, which has 4 million uninsured people, and Rick Perry turned it down.
Yep.
Although I don't think he could remember the 3 reasons he turned it down, but notwithstanding that, he turned it down.
But MNsure was created at a cost of $170 million. Now, the first thing that MNsure did and does is MNsure offers a dizzying array of 170 or more products, all offered to you by the same 4 HMOs who have been running this system forever. There are no new market entrants, and MNsure guaranteed there would be no new market entrants. Secondly, MNsure is a disaster. Unless you have a penchant for sitting on hold for hours on end, or uncertainty, or conducting transactions in some sort of Alice in Wonderland crazy world, it doesn't work.
Well, who qualifies for MNsure?
Well, theoretically, anyone. If you want to purchase your product, your health insurance product on the exchange, certainly if you want to receive the federal subsidy, you must buy the product on the exchange. The only way you can get the federal tax subsidy is to buy the product on the exchange. But the exchange appears to be an unqualified disaster. It's missed deadlines, it doesn't work. We don't need to relive the painful details of what's wrong. You know about this from reading about it in the newspaper. So the question is, and this goes back to your early comment, do you really think it could get worse than this? Because single payer, and by the way, single payer is what I'm going to call a sensational term. What we really should do is say, do you think a Medicare for All system would be in any way superior to what we have with MNsure?
Let's talk about costs, as long as you raise that. What are the costs, the administrative costs that Medicare runs on?
3 to 4%.
In Minnesota, what's the average cost,
The
administrative cost of these HMOs?
The HMOs say that their administrative costs are 10%. People who look at their costs think they're closer to 30%. Some people, like former Attorney General Mike Hatch, have said they're closer to 50%. And they are, in fact, enormous. Anyone can see that they're enormous. We have no medical loss ratio, we have no definitions, but most importantly, and I cannot repeat this enough, we have no paid claims data. We have no receipts. We have no disbursement record. We don't know what was spent on health care. We have not a clue. We give these companies billions of dollars a year, shake their hand and say, good luck. But they don't need good luck. They make money like there's no tomorrow. It's only the patients and the providers that need good luck because they suffer radically.
Now, didn't Senator Franken propose and get a bill passed involving health care costs and reimbursements and how much companies could keep for themselves of the dollars paid?
I believe that there has been some legislation involving medical loss ratio. The difficulty is if you pass a law saying there's going to be a limit, you're still left with the definition of what counts as a medical cost. If I'm an insurer and I put my name on the beer mugs at the baseball stadium, is that medical education or is it advertising? We would probably say it's advertising. The insurers say it's medical education. It's a medical cost. The insurers say virtually everything they spend is a medical cost.
Sending people to conventions at places like not only Las Vegas, but maybe to the Caribbean for updating their education.
Absolutely.
Is that a medical cost?
That's a medical cost, and and those things, as sensational as they are and as costly as they are, how about setting up subsidiary for-profit companies in the Caribbean in order to divert more money and maybe put some in your own pocket? That's also a medical cost under this bizarre accounting system. So the real issue is we haven't got a clue what's going on, but we do have a paradox. We have people trumpeting our system as the best, the cheapest, and the most efficient on the one hand, and we have studies commissioned by our state government. The Dayton administration commissioned these studies. Make no mistake about it. They hired the Siegel firm who said, this is unbelievable. These numbers are so far out of whack. It's unbelievable. It's incredible. Nobody noticed how much money is being taken. They hired this other public interest group to do a study on the value of managed care. And they say it's the second most expensive program in the country, and kids aren't receiving immunizations and child care checks.
In fact, we're way down the list of states in terms of children and what they're receiving as opposed to what they should receive.
We're way down because, I guess according to our HMO, we have care coordination. But you see, care coordination is free and an immunization costs $20. So, that pretty much explains where the money goes and what's going on. When we talk about providers and these HMOs, let me show you something that I think tells the entire story. This graph, which I'm holding up, and if somebody
do a close-up on that,
can
James.
zoom in on it here, I'm going to try to
Right
hold
over
it as
here.
steady as I can. If you look at this graph, this is what we pour into the programs. The big red bars that look like a ramp going up Mount Everest, that's how much money the HMOs get. With this camera and this resolution, the little tiny black dots at the bottom, that's what the medical providers get. And the green lines that dip below zero, that's what the specialists get. So you can see this graph represents 1998 to 2010. Enormous amounts of money are poured into the system. Medical providers get virtually nothing. What do you think happened to the
Specialists
money?
get less than
Specialists
nothing.
lose money. And by the way, dentists are a perfect example. When a person on a public program goes into a dental office, the dentist pays for that visit out of their own pocket. And the fact that they do so is a tribute to their profession.
Well, I know two doctors, one of whom was my own personal doctor, who have gotten out of the profession. One just sold his practice to a corporation, and another one gave up seeing patients to work in hospitals because of really how screwed up this system is.
As I'm fond of telling legislators, doctors and dentists, medical providers face a paradox. They treat people on Medicaid because they are committed to their profession and committed to humanity, but if they do it long enough, they will end up on Medicaid. They will go broke because somebody else is walking away with all the money. And this needs to be dealt with. This needs to be aired, this needs to be examined. As taxpayers, it is inconceivable, it is outrageous that the state can't tell you where the money went. And by the way, the state has contracts with these HMO vendors for all the years in question that says if the state asks for this information, it must be given to them. But the state, our Department of Human Services, has never asked. And when pushed on this issue, they say, well, we don't want to ask. It would make the HMOs mad. Yes, I'm sure it would.
I'm sure it would too, but at least we would have an idea of where the bucks are going.
Exactly. Exactly. So this mess that we find ourselves in the middle of, which is typified by MNsure, and now, you know, Minnesota Care has come into the fray, because as MNsure collapses, it's come to be revealed that we're putting people in Minnesota Care. Which is, you know, Minnesota Care is a fine program, but Minnesota Care is projected to have a $1.4 billion deficit. Those figures were released this past Wednesday by 2021. And that projected deficit...
Who released those figures?
The Office of Management and Budget for the state of Minnesota.
Okay.
The report's available online. Minnesota Care has always run with a positive balance. In fact, the providers who pay the provider tax, the sales tax on health care, to support Minnesota Care have always been aggrieved because they continue to pay taxes, and the program has been used historically as a slush fund to fund things other than health care. But that's the way it is what it is, and nevertheless that's what's been going on. But now we see that beginning in 2016, the bottom drops out. And why? Because the Affordable Care Act says that for programs like Minnesota Care, which are considered basic health plans, we will only pay the average cost of an insurance premium in the United States. And that is a reasonable approach. The problem is our HMOs say, no, that's not good enough. We need more. We need much more, because if you want our management, the program will operate at a $1.5 billion deficit. Tell you what, I don't want your management. Thanks for your years of non-service, and hit the road. We'll run it ourselves.
Is it fair to say that the legislature has subpoena power, that committees have subpoena power, that they could insist on seeing what's in these books, that they could question people under the penalties of perjury to find out really what is going on?
It's not only fair to say, it is 100% accurate. Absolutely they could do this. And the fact that they don't do it, that the people in charge, that the people who hold positions of power on the appropriate committees don't do it, speaks volumes and very loudly to what's going on here.
Now, we talked about lobbying. Also, can these HMOs give donations to legislators?
Absolutely.
And do they?
Oh, they most certainly do. And of course, the most popular contact sport is going to legislators and telling them, we will support your candidacy for governor. Because when you have this kind of money, you can support everybody's candidacy. You can be everyone's friend. And then behind the scenes, you pull the strings that you need to pull to make things happen your way. So you embrace all proposals and all sides and engineer it the way you want it to come out. And that goes on every day. When you are a multi-billion-dollar industry, I'm not suggesting it's unusual, but when you are a multi-billion-dollar industry that makes all its money off of taxpayer-funded programs, I'm suggesting there's something wrong with that.
I would like to say it's always a pleasure to have you here, Dave, but the fact of the matter is, every time you come in here, it's frightening as you lay out the facts. And your knowledge of the industry is so wide that it just paints a terrible picture in a society that's plagued with similar situations throughout. And so while I thank you for coming in and sharing this with us, it leaves us with a little hollow feeling in our stomach.
Well,
notwithstanding that, we're going to keep having you back, and we're going to hope that maybe the system can be cured.
And that's an appropriate analogy.